My name is Ingrid. I'm from Group 3 and I start with my day on 19th of July. The day started at the center where I had two paramedics in ambulance number 30. My first occurrence, a very frail elderly woman living in a shelter of the elderly asylum. For around 85 years old, she was laying and shaking. She had difficulty speaking, did not move alone. Was done. Blood pressure was measured, which is normal. After the procedure, we waited for the caregiver to prepare the patient to be taken away, change her diaper and clothes. After the patient was ready, she was placed on a stretcher and taken to the ambulance. We took her to the Oblastnaya hospital. The second occurrence is a female patient around 50 years old. We arrived at the building and the patient was already waiting, and she just entered into the ambulance accompanied by the paramedic who came down to help her up and complained of a lot of abdominal pain, patient with fever. She was crying and restless in pain. We took her to the BSMP hospital with supposition of appendicitis. And again, we went back to the BSMP hospital where we left the early woman in the ambulance. Fourth occurrence, it's a female patient, 49 years old. Hit beat a speeding bicycle. Main complaint was dizziness. Patient created a lot from the shock of the trauma. She fell on her arm, causing the fracture, and also hit her head. Elbow fracture. She was bleeding and very swollen. And the ECG was performed, which was a normal, and the blood pressure was also measured, which was also normal. Ketorolac analgesic medication was applied, and the patient the patient go to the traumatology hospital.